The critical role of vitamin K2 in bone and cardiovascular health. Introduction. Vitamin K is an essential fat-soluble nutrient that plays a pivotal role in blood clotting, bone mineralization, and cardiovascular function. It exists in two primary forms, vitamin K1, phylloquinone, and vitamin K2, menaquinones. While K1 is abundant in green leafy vegetables, K2 is primarily found in animal products and fermented foods. Emerging research highlights the crucial role of vitamin K2 in calcium metabolism, ensuring that calcium is directed to the bones where it belongs, rather than accumulating in the arteries, where it can lead to dangerous calcification. Understanding the two types of vitamin K. Vitamin K1, phylloquinone, found in high concentrations in green vegetables such as kale, spinach, and broccoli, primarily supports blood clotting by activating proteins in the coagulation cascade. Vitamin K2, menaquinones, exists in several forms, MK4 to MK13, with MK4 found in animal products and MK7, MK9, and others found in fermented foods. Essential for regulating calcium metabolism and preventing arterial calcification while promoting bone strength. While K1 primarily contributes to blood clotting, K2 is involved in activating proteins that help ensure calcium is deposited in bones and teeth rather than accumulating in the arteries, which could lead to cardiovascular disease. The vital role of vitamin K2 in calcium regulation. Vitamin K2 regulates calcium by activating two key proteins. First, osteocalcin. Osteocalcin directs calcium to the bones and teeth, where it is needed to strengthen bone density and support structural integrity. Without adequate vitamin K2, osteocalcin remains inactive, resulting in inefficient calcium utilization and an increased risk of osteoporosis and fractures. 2. Matrix Gley protein, MGP. MGP prevents calcium from depositing in the arteries, reducing the risk of arterial calcification. Studies suggest that inactive MGP due to low vitamin K2 levels is associated with an increased risk of cardiovascular disease. When vitamin K2 is sufficient, it activates both osteocalcin and MGP, ensuring that calcium strengthens bones while preventing harmful arterial calcification. Vitamin K2 and bone health, preventing osteoporosis. Osteoporosis, characterized by low bone mass and increased fracture risk, is a growing concern, especially among older adults. Calcium is often recommended to prevent bone loss, but without adequate vitamin K2, calcium cannot be efficiently incorporated into bones. Synergistic action of vitamin K2 and vitamin D. Vitamin D enhances calcium absorption from the intestines, but without adequate K2, the calcium may deposit in the arteries rather than the bones. Vitamin K2 directs this absorbed calcium to the bones, working in tandem with vitamin D to promote bone strength and reduce fracture risk. Research evidence. A study published in Osteoporosis International found that postmenopausal women supplementing with both vitamin D and K2 experienced a greater reduction in bone loss compared to those taking vitamin D alone. Another study demonstrated that supplementation with MK7, form of vitamin K2, significantly improved bone mineral density and reduced the risk of fractures in older adults. Vitamin K2 and cardiovascular health, preventing arterial calcification. Arterial calcification, where calcium deposits accumulate in the walls of blood vessels, increases the risk of heart attacks, strokes, and cardiovascular disease. Vitamin K2 plays a critical role in preventing these deposits by activating MGP, which binds calcium and keeps it away from the arteries. Research on vitamin K2 and cardiovascular health. A landmark study known as the Rotterdam study followed over 4,800 participants and found that higher vitamin K2 intake was associated with a 50% reduction in arterial calcification and a 57% reduction in cardiovascular mortality. Another study published in Thrombosis and Hemostasis found that MK7 supplementation improved vascular elasticity and slowed arterial stiffening. Signs of vitamin K deficiency. Vitamin K2 deficiency is widespread in Western diets, primarily due to the lack of fermented foods and the predominance of processed foods devoid of beneficial nutrients. Common signs of deficiency include easy bruising and prolonged bleeding, increased risk of fractures due to weak bones, arterial stiffness or calcification, potentially leading to cardiovascular issues, poor dental health as K2 is involved in maintaining healthy teeth. Who may be at risk of vitamin K2 deficiency? Several populations are at higher risk of vitamin K2 deficiency, including older adults. Age-related changes in nutrient absorption increase the likelihood of deficiency. Individuals on long-term antibiotics. Antibiotics can deplete beneficial gut bacteria, which produce some forms of K2. People with digestive disorders. Conditions such as celiac disease, Crohn's disease, and ulcerative colitis impair nutrient absorption. Those consuming a low-fat diet, vitamin K is fat-soluble, and low-fat diets may limit its absorption. Dietary sources of vitamin K2. While vitamin K1 is abundant in leafy greens, vitamin K2 is less prevalent in most diets. Incorporating vitamin K2-rich foods can help prevent deficiency and promote long-term health. Top sources of vitamin K2: animal products, grass-fed meats, liver, egg yolks, and butter. Fermented foods: natto, fermented soybeans, sauerkraut, and certain aged cheeses. Fish and seafood, especially fatty fish such as salmon and mackerel. Should you supplement with vitamin K2? Because vitamin K2 is often lacking in modern diets, supplementation may be beneficial for many individuals. MK7 is the most bioavailable and long-acting form of vitamin K2, making it ideal for maintaining consistent levels in the body. When to consider supplementation: if you consume a diet low in fermented foods and animal products, if you are at risk of osteoporosis or cardiovascular disease, if you are taking vitamin D supplements, as K2 ensures calcium is utilized correctly. Dosage and safety considerations. Research suggests that doses of 100 to 200 micrograms of MK7 per day are effective for maintaining optimal vitamin K2 levels. Since vitamin K is fat-soluble, taking it with a meal containing healthy fats enhances absorption. Safety note: vitamin K. Supplementation is generally safe for most people, but may interact with blood-thinning medications such as warfarin. Individuals on anticoagulant therapy should consult their healthcare provider before adding vitamin K2 supplements. Conclusion: vitamin K2 is an unsung hero in maintaining bone health, preventing arterial calcification, and supporting cardiovascular wellness. While often overshadowed by vitamin D, K2 plays an equally vital role in ensuring that calcium is utilized correctly by the body. Since modern diets often lack adequate K2, incorporating fermented foods, grass-fed animal products, or supplementation can help bridge this gap and promote long-term health.